What is Plaquenil and what is Plaquenil used for? Plaquenil is used to prevent and treat acute attacks of malaria in adults and children weighing more than 31 kilograms, 68 pounds. It is also used to treat discoid lupus erythematosus, DLE, a chronic inflammatory condition of the skin, or systemic lupus erythematosus, SLE or lupus, an autoimmune disease in which the immune system attacks healthy parts of the body such as joints, skin, blood vessels, and organs, and rheumatoid arthritis. Plaquenil is in a class of drugs called antimalarials and is also an antirheumatic drug. It works by killing the organisms that cause malaria. Plaquenil may work to treat rheumatoid arthritis and systemic lupus erythematosus by decreasing the activity of the immune system. How to use Plaquenil? Plaquenil comes as a tablet to take by mouth. Plaquenil tablets should be taken with food or milk. If you are taking Plaquenil to prevent malaria, one dose is usually taken once a week on exactly the same day of each week. You will begin treatment 1 to 2 weeks before you travel to an area where malaria is common and then continue during your time in the area and for 4 weeks after you return. If you are taking Plaquenil to treat malaria, the first dose is usually taken right away, followed by another dose 6 hours later and then 2 additional doses, 24 and 48 hours after the first dose. If you are taking Plaquenil to treat lupus erythematosus, DLE or SLE, or rheumatoid arthritis, it is usually taken once or twice a day. Follow the directions on your prescription label carefully, and ask your doctor or pharmacist to explain any part you do not understand. Take Plaquenil exactly as directed. Do not take more or less of it or take it more often than prescribed by your doctor. Swallow the tablets whole, do not split, chew, or crush them. If you are taking Plaquenil for symptoms of rheumatoid arthritis, your symptoms should improve within several weeks to months. If your rheumatoid arthritis symptoms do not improve, or if they worsen, call your doctor. Once you and your doctor are sure the drug works for you, do not stop taking Plaquenil without talking to your doctor. Symptoms of rheumatoid arthritis will return if you stop taking Plaquenil. Other uses for this medicine. Plaquenil is also sometimes used to treat porphyria cutanea tarda, condition in which certain natural substances build up in the body and may cause painful, blistering skin due to sensitivity to sunlight. Talk to your doctor about the possible risks of using this drug for your condition. What special precautions should I follow? Before taking Plaquenil, tell your doctor and pharmacist if you are allergic to hydroxychloroquine, chloroquine, primaquine, quinine, any other medications, or any of the ingredients in Plaquenil tablets. Tell your doctor and pharmacist what prescription and non-prescription drugs, vitamins, nutritional supplements, and herbal products you are taking or plan to take. Your doctor may need to change the doses of your medications or monitor you carefully for side effects. The following non-prescription or herbal product may interact with hydroxychloroquine, Plaquenil, cimetidine, Tagamet HB. Be sure to let your doctor and pharmacist know that you are taking this medication before you start taking Plaquenil. Do not start this medication while taking Plaquenil without discussing it with your healthcare provider. If you are taking antacids, take them 4 hours before or 4 hours after Plaquenil. Tell your doctor if you or anyone in your family has or has ever had a prolonged QT interval, a rare heart problem that may cause irregular heartbeat, fainting, or sudden death. Also, tell your doctor if you have or have ever had heart failure, a heart attack, an irregular heartbeat, or any other heart problems, a low level of magnesium or potassium in your blood, psoriasis, porphyria or other blood disorders, G6PD deficiency, an inherited blood disease, dermatitis, skin inflammations, seizures, vision problems, including macular degeneration, an ongoing disease of the eye that causes loss of the ability to see straight ahead, diabetes, kidney or liver problems, or if you drink large amounts of alcohol. Tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. If you become pregnant while taking Plaquenil, call your doctor. You should know that Plaquenil may cause serious and potentially irreversible eye problems. You will probably need to have regular eye exams during your treatment with Plaquenil. Tell your doctor if you have any of the following: blurred vision, floaters in the eye, seeing flashes of light, or other changes in vision. You should know that Plaquenil can cause hypoglycemia, low blood sugar. Your doctor may tell you to monitor your blood sugar. Call your doctor or get emergency medical treatment if you have symptoms of hypoglycemia, including dizziness, weakness, tiredness, sweating, nausea, rapid or irregular heartbeat, confusion, fainting, or loss of consciousness. What should I do if I forget a dose? Take the missed dose as soon as you remember it. However, if it is almost time for the next dose, skip the missed dose and continue your regular dosing schedule. Do not take a double dose to make up for a missed one. What side effects can Plaquenil cause? Plaquenil may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Headache, loss of appetite, nausea, diarrhea, stomach pain, vomiting, difficulty hearing, ringing in ears, hair loss, hair color changes. If you experience any of the following symptoms or those mentioned, call your doctor immediately. Hives, rash, swelling of the face, eyes, mouth, throat, tongue, lips, hands, feet, ankles, or lower legs, or difficulty breathing or swallowing. Blisters on the skin, eyes, lips or in the mouth, or itching or burning skin. Muscle weakness, burning, numbness, or tingling in the hands or feet. Unusual bleeding or bruising. Cough, fever, sore throat, runny nose, or other signs of infection. Mood or mental changes. Fast or irregular heartbeat. Lightheadedness, dizziness, or fainting. Unusual tiredness or weakness. Seizures. New or worsening depression. Mood changes. Thinking about harming or killing yourself. Plaquenil may cause other side effects. Call your doctor if you have any unusual problems while taking this medication.